Causes of leg length discrepancy. What are the causes of leg length discrepancy? In here there is true shortening and apparent shortening. Causes are two: true shortening and apparent shortening. One is old fracture of the tibia, then old fracture of the femur, poliomyelitis. So old fracture of the tibia, old fracture of the femur, poliomyelitis. Then coxa valga. In coxa there is femoral neck fracture, leg Carpart disease, and slipped capital femoral epiphysis. Then coxa valgus. And there is loss of articular cartilage like infection and arthritis, and the dislocation of the hip. So in true shortening there is old fracture of the tibia, old fracture of the femur, poliomyelitis, old fracture tibia, old fracture femur, poliomyelitis. There is coxa valgus. In coxa femoral neck fracture, leg Carpart disease, and slip capital femoral epiphysis. Others are loss of articular cartilage like infection and arthritis, and the dislocation of hip. In apparent shortening there is adduction contracture of the hip, plantar flexion of the foot, on the affected side, and the flexion of knee on the other side. So in apparent shortening, so adduction contracture of the hip, plantar flexion of the foot on the affected side, and flexion of knee on other side. So these are the causes of leg length discrepancy. So I am just cut shorting. In leg length discrepancy, it can be different. It can be told in the form of true shortening and apparent shortening. True is old fracture of the tibia, old fracture of the femur. There may be coxa femoral neck fracture, leg Carpart disease, slip capital infection like loss of articular cartilage, poliomyelitis, dislocation of the hip.